Hi, everyone. Today, our guest is Dr. Vignesh, an Ayurvedic doctor and fourth-generation Ayurvedic healer in his family. He is also the founder and lead physician of Sitaram Beach Retreat in Kerala, India. Dr. Vignesh also specializes and researches in Panchakarma, which we'll get to know a bit what it is during our conversation. But as you guys know, this month is the month of November, and we are closing off our month with Dr. Vignesh and covering a topic that is quite close to our men's health, which is prostate cancer.
So welcome to Dr. the Podcast, Dr. Vignesh. We are really excited to have you today and speak about this topic. Thank you for being here with us.
Thank you.
We'd like to start with, I guess, a little finding that we found online, according to the Cancer Research UK, which says that 1 in 6 UK males will be diagnosed with prostate cancer in their lifetime, where a person's risk of developing cancer depends on factors including age, genetics, and exposure to risk from avoidable lifestyle factors. However, there is a 78% survival rate for 10 years or more, particularly in England and Wales. I guess maybe we can trail it back and maybe get your insight on what actually is prostate cancer and what happens to the body when we see that happening in our male friends or family members.
Mm-hmm. Thank you, Tasha. So when it comes to cancer, the word itself is like an enigma. Many people are still finding out what can be done, what can be prevented, what are the best ways to deal with it. Sometimes chemotherapy, sometimes radiation. Sometimes chemotherapy can be worse than the disease itself. Sometimes we hear people have like 6 months or 1 year. Sometimes we hear that the judgment has been given by the doctor. Maybe they have like 2-3 years, but still they overcome that. So there is the best word to describe cancer is the word enigma. It's still a lot to understand and research and to find out. Now, as you mentioned about this statistics is like half of the truth. Right. That is what they could find out. The other half we don't know.
It's a good way to put it. Yeah.
So it's again, it's like an hypothesis. There is no guarantee about it. And we spoke about age. We spoke about genetics. These two are things that are inevitable. We cannot select our genetics. It's something that is predestined. But avoidable environmental factors, that is something that we have under control. So where does this come to? And that is the area that we could focus on. We could educate people on. And definitely. When it comes to prostate, the PSA levels usually go up after 50s and 60s of a man in general.
So before we go into that, maybe it would be great to understand what is the prostate and what it can do to men, like its function in a more very basic way so that we kind of situate the context.
So if you look at the prostate gland, it is something that nourishes the sperm. It helps to produce a seminal fluid, which is helpful in transmitting the sperm so that it can be ejaculated.
Right.
So this function is very important for continuing the species, because if that stops, it's as good as a man being infertile. So it plays a very important role in the reproductive capacity of human beings. So, and if you look at it, it's a very chickpea kind of a size. And to get it inflamed is quite easy for a prostate gland if there is an unhealthy lifestyle. So PSA levels, when it goes up, it's a sign that there is an inflammation happening in that organ, in that gland. So that is what
PSA means.
Prostate antigen test.
Okay.
So when this goes up, it's a sign. It's a test done. You can go to any laboratory where they do the blood work, and you can ask to do need to check the PSA levels.
Right.
Okay. Different countries have different meters, like UK and America, they use pounds and kilograms, so they have different ways of looking at it. However, if it is coming in the normal value, it's fine. If it goes up, today what is happening is many people panic. It could be a potential cancer.
Right.
So it can go even to let's get it removed. These are some of the aspects that people say.
Yeah. So, which comes to my next question is that if somebody says that you want to remove some, can they live a healthy lifestyle without it?
So it's like just like how breast cancer is a problem for women. Prostate cancer is the male equivalent of breast cancer.
Right.
This is how the current situation is. Now, one of my findings, one of my colleague, Dr. S.P. Srijit, I studied with his mentor, who is one of the first oncologists. His name is Dr. C.P. Matthews. He was one of the first oncologists in India. He just passed away a month before. So one of his approaches, having prostate cancer is the best cancer a man can have compared to many other cancer a person could have. In a, let's say that now things are worse, but among what things could be worse, this is the best case scenario.
Right.
That is his approach of saying. And then he says that, okay, so I was sitting with him while he was, consulting a patient who had prostate cancer. And then this Dr. C.P. Matthew, who's an oncologist, he integrates lots of Ayurveda and Siddha into his practice. And also he has a holistic approach of treating cancer patients. So he influenced a lot of my way of viewing how to treat cancer. Not that I'm expert, I'm just still learning, and still many oncologists are still learning about it. So what his experience, he has over 40 years of experience in treating cancer and 62 years of experience in treatment. 40 years, he experimented with Ayurveda and Siddha in his oncology treatment. So what he was saying, prostate cancer is the best cancer a man can get among all the cancers that could go worse. And if that happens, removing prostate is the easiest method, but that is like when things are really out of control and if the person is really healthy, that removing it will help. Sometimes removing it could be not so great. Or undergoing chemotherapy can worse than undergoing the cancer itself, letting the cancer spread on its own natural ways. So this has to be used in a very judicial way and time to time basis. A generalized a clinical approach cannot be given to everyone. So patient to patient, age by age, the patient's strength, the willpower, the emotional willpower, all of that has to be taken into consideration, because the moment somebody gets diagnosed with cancer, it's a real havoc in their life. Everything takes a U-turn in their life. They will be thinking, oh man, should I write my will? What's going to happen to all the things that I'm doing? Who will take care of my family? It's like completely a standstill, like a lightning bolt.
Right.
Like in Kerala, we say it's like, we have power shutdowns once in a while. So you're watching a high intense movie and suddenly the climax is supposed to happen and then the shutdown happens.
Yeah.
That's what happens to the life.
Yeah.
So it's really like, I mean, if you see someone going through cancer, there's so many aspects for it, right? So there's like the actual cancer, the issue, like the biological aspect of it, but then there's the psychological aspect of it, what it creates, and then the treatments, what are the byproducts of those treatments. So it's a very complex situation. But on its own, the prostate, does it have other byproducts that can be helpful for one's like kind of
there are so many people who got it removed and are
still
quite fine.
Okay. Okay, it makes sense.
Okay, it's not like okay, there are certain organs which you cannot afford to remove.
Exactly.
Some organs, if you remove it, still okay. If you remove one kidney, you can still live with it.
Right.
You just need another kidney. Certain uterus in a woman, if it's removed, it's fine. She can still, maybe she might need to take some hormones. That should be there. So same way, prostate, if it is removed, it's okay. It's not like, unless the fear of surgery and getting something removed from the person's body, apart from that psychological impact, it should be fine.
Okay.
But in general, it's a part that makes the masculine, it contributes to the masculinity of a man, and nobody is willing to get it out so easily if that can be holistically managed. So that's the idea. And also the sexual functions could be impacted.
Right. And so as you're saying this, like, what would be an Ayurvedic approach when you come into a discussion, when you speak to a patient who's diagnosed by prostate cancer, right? At which stage do you recommend? And I know you say case by case basis, but like, how would you approach a person in stage 1 cancer, and how would you approach someone in a stage 4 cancer, for example?
So I always take opinions of senior oncologists who are willing to integrate holistic approach. So if there are other aspects, usually when they reach the stage of cancer, it just does happen, 80% of it doesn't show up in the beginning. And people usually detect it quite late. So that's why detecting it early is the first best step than anything else.
Yeah.
So if detection is early, then in some cases, definitely a lot of it can be done. But if you're detecting it quite late, then things could go out of control. And if the patient is strong, then the best is going for a radiation or chemotherapy. But if the patient is not so strong, chemotherapy could be really harmful.
Yeah.
So what one of my teachers, Dr. C.P. Matthews, what he was saying was, in some situations, orchidectomy, which is removal of the testis, that could stop the spread in a very fast way. It could delay the spread. This is one thing that he recommended. And then taking a lot of micronutrient-rich food, getting into a healthy lifestyle, and some of the Ayurvedic medications that are like anti-aging, these could be given to, to handle the situation. It's like a palliative care, but a much more palliative care. It's like everybody is going to die at one point of time. There's no escape from death.
Yeah.
But it's like adding more life to the years that they have. That's the approach that can be done. And if the cancer is quite serious, then chemotherapy is the best way. They have to go to an oncologist and get the chemotherapy or even radiation done, or sometimes prostate needs to be removed at a much early, if it's a very early detection stage. But once it spreads to other parts, then it's out of control. And getting into healthy lifestyle and getting into the best emotional state, which is going to be like fighting gravity at that point of time, but they don't have other choice from that.
Right. So that makes sense, because like even myself, like I've experienced with family members who are more resilient, but who've been diagnosed with stage 3 cancer and managed to prolong their lives with just better lifestyle choices and dietary choices. More like the doctor prescribed 6 months more, and then they managed to prolong by like 8 years because of like better choices. And so like, how does Ayurveda approach in terms of like nutrition, lifestyle choices? Like what are some common things that prostate cancer patients would have to kind of adapt in their journey?
So it's not like there is a specific lifestyle just for prostate cancer. The healthy lifestyle is applicable to all. And like we said before, genetics and age can contribute to this. Genetics could contribute. So the healthy lifestyle to some person could help them prevent getting breast cancer. Healthy lifestyle for someone could help prevent colon cancer. The healthy lifestyle for someone else, it could prevent from getting into prostate cancer. So healthy lifestyle could be, that is something that you can generalize, but depending on the person and their genetic predisposition, it could be preventing certain things. So here, when it comes to this prostate especially, so if they have a tendency of too much mucus producing tendency in the body, like for some people, mucus production could be leading to bronchial asthma, block in the nose. They could get constant allergies. They say that in the morning when I get up, I have a lot of mucus in my throat, and this can happen.
Yeah.
So this prostate gland PSA levels, inflammation happening there, it could be, in another word, there is a inflammation in that area, which is also like mucus going up. So when I say mucus, it's a very generalized term. Inflammation could also be considered to some extent mucus. In Ayurveda, there is a particular word called as kleda. Kleda actually means a kind of mucus. Diabetes is also a kind of kleda because there is a mucus involved there. It's a kapha disease. There's too much of mucus load in the body. Right. Allergies, when they have running nose, mucus blocking the nostril, that's also a kind of kapha problem. So bringing down the excess kleda or mucus load in the body is one way that you can reverse to a great extent or delay the problem that is going to happen, irrespective whether it's prostate or anything else. Because once the mucus load goes down, the body's channels are open and we can breathe better, we can live better, our energy flow is fantastic. When the mucus load goes high, there is a traffic block that happens in our body. The natural flow is blocked.
Right.
If you look at the word for pain in Sanskrit, it says ruk, and ruk means block. So whenever there is a block, the flow of energy is not going to be smooth, and that will create a lot of changes. And these changes is what is coming to let us know as pain. Right. So getting rid of the excess mucus load is one of the most important ways, which means getting rid of excess sugar, fried, salty food, too much of milk products, because milk is mucus again, sugar is mucus again, alcohol, it will lead to a lot of mucus production in the body.
There's a lot of things that how do you live in the modern world and eliminate a lot of these factors that you just mentioned?
Well, that's what we mentioned from the beginning about the statistics, avoidable environmental toxins coming from these avoidable.
Yeah. Right. That's a tricky adjustment. But I guess if you're in a situation where you have to, you make the necessary changes, right?
Exactly.
Yeah. And so you say that like mucus dominant or mucus enhancing foods, substances, like would encourage, I guess, inflammation and maybe potentially encourage excessive growth cells in the body. So for men, I guess that would be it could be prostate cancer. Are there any other types of things that come to mind, or maybe in your own experience with patients that you've come across?
You mean the excess mucus load? What else it could lead to?
No, meaning like other things like excess mucus. Are there any other types of?
Yes, of course. Stress plays a very important role. Sleep plays a very important role, and circadian rhythm, surrendering to the circadian rhythm plays an important. I know a person who has such a healthy lifestyle. This is what, when you look from outside, he doesn't eat meat, he doesn't drink alcohol or smoke, eats very good nutritious food, but he travels a lot, doesn't sleep well, and goes to different time zones, and that impacted and that took a toll on his health.
Right.
So routine helps to keep our body feel safe. So when we go out of routine, our body gets into a stress mode, and it completely imbalances the normal hormone regulation.
That's a really good point. Like how stress, like the word you said is that routine makes our body feel safe, and that is the aspect, the environmental factor that you can work on it, making it safe. And so doctor, like as you're Dr. Vignesh, as you are specializing in Panchakarma, how maybe we could get a bit of an introduction on what it is for our listeners, and could you explain how that could help in either preventing or recovering from prostate cancer or just cancer in general?
So Panchakarma is 5 therapies that helps to eliminate unwanted toxins from our body. So there are so many, people ask, why do we need to detox? But we live in an environment where we are having abundance problem than scarcity. Our body is designed to live in scarcity. Our brain is designed to survive in scarcity. But today we have created an environment where food is abundant, the information, that entertainment is abundant. So we are having more abundance problems than scarcity problems. So when you have abundance problems, we need to refrain. Abstinence is one of the ways, and also eliminating things that our body is having it in excess. So last time when you heard somebody died, or when was ever time you heard somebody died because they didn't get any food? But we hear people died of cancer, we hear people died of heart attack, because these are issues of abundance. We are consuming more than what we need, and we are having a lifestyle that is not what is aligned with how the nature has designed our body. So in such a situation, Panchakarma is something that helps to bring back your body to its normalcy, to alignment to how the nature has designed the body. So it has 5 ways of getting rid of the toxins. One is Nasyam, where we use some special herbs or liquids or powders to insert to your nostril. So this helps to remove the mucus load from your nostril. That is called as Nasyam. The other one is through your mouth, like, when you drink something you don't like, you end up vomiting. If you see some dogs, when they're not keeping well, they go and eat the grass and they vomit and they feel good. Same way, we are artificially creating an environment in the bodies, and we give some special herbs. So it creates like a nausea, and you vomit out all the toxins that you don't need. But this has to be done under proper strict supervision, and this is not for everyone. It is strictly on patient to patient cases. And people with migraine, if you ask, they say that they get a nausea once they get the migraine, and after they vomit, they feel good. So this is the way nature has designed. So we are just creating we are using the same intelligent pattern of the body, and we are artificially creating that so that the mucus load in the body gets released. And the other one is purgation, where we clean the intestines, where we give some special herbs. It irritates the intestinal walls, and where we flush out, like we have a therapeutic diarrhea. We call it virechana. And the other one is enema.
Such a nice way to put it.
Yeah,
Such
very
a nice
nice
way to
way.
put it.
The other one is enema. There are 2 types of enema. One is with oil and one is with decoction. And bloodletting is also considered one among the 5 therapies, because when you remove a little bit of blood, up to 300 to 400 ml, according to the World Health Organization, if you're healthy, you can remove 450 ml of blood every 3 months. But if you're not so healthy, sometimes if your uric acid is high, we cannot just eliminate it. So bloodletting helps to release a little bit of it from the system. So these are the 5 therapies, and it's not that we do all the 5 therapies when you come to an Ayurveda retreat. Sometimes you just need 2 or 3 of them. But doing these, The body has to be prepared for that. And after the cleaning, you have to recover from that because it's a stressful incident that's happening.
Right.
So doing these therapies after you're diagnosed with cancer is not so easy, and it's quite rare that Panchakarma can help. In some cases, yes, it might help. But this helps best when you do this so that you don't end up getting into a situation like cancer in the first place. So that's one aspect that we can look at it. Because by doing Panchakarma, what's happening is you're reducing the inflammation, your mucus load, and unwanted toxins in the body. We have even documented patients who had high levels of mercurial toxicity and arsenic because they were deep into seafood and they were feeling tired. And when we did the blood test, their arsenic levels and the mercury levels were very high. And after 21 days of this therapy, which included Panchakarma, and when we retested the blood, the mercury levels and arsenic levels were completely on the normal level. But this is far away from getting it published in a research article. So just because you got to see this in few people doesn't mean this is science worthy till it is proven in at least 100 to 200 people minimum. But definitely, so many patients, they keep coming back saying that after they do this, they feel so relieved, relaxed, more energy, and their cravings are not there. They get more work done in less time. Their sleep is much better. They feel more light in the body, and the pain thing is also not there. And Panchakarma cannot be done on a person who is having extreme anxiety or extreme depression. At the same time, they have a weak body. They need to have a little bit of strength and willpower to undergo this process because it needs a lot of endurance power to go through this. So it's a thin line that we need to walk. Not everyone can do it. And there is no universal protocol. This is how it has to be done in everyone. It will be customized from person to person. So by doing this, what happens is the inflammation reduces, the mucus load reduces, so that your blood is purified. So once that happens, you don't have to worry about such kind of a situation. But apart from that, your emotions also play a role, your sleep hygiene also play a role, the food that you have later on also play a role. See, you could hear many people saying they went through a divorce and later they were diagnosed with cancer. They had a financial distress and later they got diagnosed with cancer. And you could relate after that incident, that's when they got cancer, because of the emotional stress that could lead to high levels of cortisol, that could lead to, that could trigger unhealthy lifestyle. And that ends up with things like cancer or some terminal diseases. That's not a rocket science to correlate that. So when you do Panchakarma, what happens is every time you come and do this, you disconnect from the world. And when you are doing this process, you tend to re-question, what are my priorities? Should I just keep running behind something that is not giving me fulfillment? And success and fulfillment can be two different things. But if it comes if both of them comes together, success without fulfillment, it's worse than failure. But when you have both of them together, that's what makes life beautiful. So it's not just eliminating stuff, it's also eliminating unwanted stuff that you put into your mind. It's also a digital detox that happens at that period of time.
Right. And I mean, I'm curious to know because, when people come for Panchakarma treatments, for example, for any illness, or and they come to a retreat or like a center, right? How is it, I guess, how do they take that and then apply that in, the world and the environment that they live in, back in wherever they live in, right? Because a lot of times I'm always wondering, like, when you go for these treatments, yes, they're very effective and they give you a reset so that you can start from somewhere new. But when you go back to the familiar environment, how does that integration happen, and like how do you encourage people to take those principles with them?
Yes. So some people, because they are convinced, even after doing such a treatment like Panchakarma, they will go back to their old lifestyle patterns. So there's no point doing Panchakarma. So for them, I tell, it's like saying, I know after taking shower, my body is still going to get dirty, so I rather not take shower.
That's a great analogy. Yeah.
We once in a while we go and we do this so that we get reminded what it means to feel healthy. Many people don't know what it means to feel, what it feels like being healthy. So that reference point, the more we get in touch with, we want to protect that feeling. So then, when somebody comes with you an option of eating more, you say, no, I don't want that because I want to protect this feeling. I don't want that instant gratification. On the long term, I'm not going to feel good. So we start to relate. And there is a statement, when you have an itchy skin, itching is the greatest pleasure. So you don't understand what it means to have a healthy skin, because itching is the only pleasure that you got. So till then, you need to have that reference point of what it means to be healthy so that you're able to reach that stage. So when you do a Panchakarma, then your choices will change, your routine will change, because you want to keep up that feel good factor. So it's like a jump start so that you can get into a healthy lifestyle. People say, oh, I feel so out of my life. I would like to go back and connect with myself so that I could start a new chapter in my life where I'm healthy. So in such a situation, Panchakarma is a great way to restart.
At what stage would be the best time to introduce Panchakarma in someone going through prostate cancer or cancer in general?
The best is always you do it so that you don't end up with the cancer. In case you
It's
are
the preventive
diagnosed with,
side,
yes,
yeah.
in case you're diagnosed with it, you have to check for firefighting first. What are the damage control and the crisis management that you need to do first? Emergency management is the first step the moment you're diagnosed with it. And then maybe, let's say, a prostate removal is going to happen. If that is done, and if the cancer has not spread, very lucky. Then in such a situation, a mild Panchakarma, maybe after 3 to 6 months, can be done so that the recovery is very quick. But if it started spreading, then Panchakarma need not help. What they need is more of a palliative care, relaxing therapies, getting more vitamins, and some of the medications that could help to delay the spread of cancer. That's what can be done.
Sorry, and when you were saying firefighting, are you referring to the allopathic world
Yes,
of
exactly.
having
Yes.
medication? Yeah,
Exactly.
I just wanted that to be clear. Okay, so we firefight the effect. You let 2 or 3 months of its effect, and then
the recovery stage is where things like Ayurveda and holistic approach can help.
Right.
Damage at the time of damage, when you follow a holistic approach, you don't end up in a stage where you need damage control. And when you need damage control, at that time, holistic approach need not work. So you get it done first, and then you work on how to not to get back to that stage again.
Right. So that you really see like where it's a complementary medicine.
Exactly.
That's where it is a complementary medicine, right? It can support each other. And so I guess for people who are going through, prostate cancer today, do you have any advice or like tips for them on how to navigate this journey that they're on from an Ayurvedic perspective, and maybe your own life experience as well?
Okay. First of all, don't take this as a universal prescription for everyone with that.
For sure, yeah.
High on vitamin C, like amla, aloe vera, amla, like the Indian gooseberry, or citrus fruits, which has high vitamin C. Vitamin C is known to be very helpful there. Then products like ashwagandha that can help. Then one of the problems that they would have is urinating a lot at night. That will disrupt their sleep, and because of which they could not have a proper recovery the next morning. So if they could meet, definitely, I'm sure they might be visiting good urologists who would be prescribing them with diuretics so that they don't have this issue. So in such situations, making sure the liquid intake is not so high after 5 o'clock so that they have a proper sleep is also an important part, because good sleep will help their nervous system to relax and also to make sure that their recovery is very good. And then definitely surrender to circadian rhythm, emotional hygiene, all of this. And then depending on case to case, some of the Ayurvedic medications, including ashwagandha, can be very helpful. And ashwagandha is just one of the tip of the iceberg, so that they understand what.
Yeah, and I think that the reason why you're also being careful in even discussing about this, because in Ayurveda and in most of those traditional and ancient healing systems, is that each bodies are seeing and categorized in different ways. So that's why you kind of touch upon the kapha type of body, or vata or pitta, which are, again, that's why everyone is a unique kind of constitution. And so the way you would prevent or approach someone who is diagnosed with cancer, even in that sense, would be different.
Exactly. Yes.
How is that different in the sense, like, say, we could touch very briefly on the fact that, you are, say you are pitta, or say you are vata, and you have kapha producing kind of, which is mucus, and how do you approach that?
See, everybody, we all will have a genetic predisposition. Like, for example, if my parents had a body that has high heat generating tendencies, there's a high likely that I could also inherit that. If my parents had a likelihood of eating heavy and they put on weight, and then I could also have a genetic predisposition. If I continue the same lifestyle, I would also end up the same way. So understanding what are your genetic predisposition that could lead to unhealthy stage if you don't consciously take a deviation from that patterns. That is the concept of dosha. So prostate, we have a lot of correlation with kapha because it is producing seminal fluid, which is actually kapha. So when there is a tendency of producing too much kapha, all the food that does not produce too much of mucus, all the has to be incorporated, and the foods that produces mucus has to be reduced. This is one step.
Mhm.
So all kapha hara means reducing kapha or reducing mucus load or anti-mucus diet. This is what you can follow.
Is it fair to assume that cancer in general, different cancers, because they're producing cells, and usually it's because of mucus, that it's a kapha related disease?
No, we cannot have maybe there could be some correlation, but it's again very difficult to completely bridge the cause and effect there. It could be a co-influencing factor.
Right.
It could be.
Okay.
And you could see that.
Right. So it could be, for example, because of, say, heating, like pitta type of behaviors that enhance mucus production.
Immunity is compromised. Their rest and recovery would have also been compromised, and they may not be taking the right food that are rich with the micronutrients the body needs, and all of that put together. See, if something is wrong with the fruit of a tree, we just don't go and fix that fruit. We fix the root. We make sure that enough water is given, the environment around the tree is also nice, and that is what is going to change in the end. But if there is any infection, maybe we might just chop off that part of the tree so that it can regrow if it is that situation. So that's what the holistic approach is here.
That's a really nice analogy. Again, many good analogies in this conversation today. So I guess that really does sum up, like, our conversation today and what we want to kind of put out there for our listeners. And because cancer is a really touchy subject, right? And so it's just like a gateway for them to be aware and to understand that there are ways to approach it without, because everyone's going to freak out if they hear the word, if they're diagnosed, God forbid, but it happens, right? And so this is just a pathway for them to figure out there's alternative medicine that could support them, and different stages and in what ways, in different ways. And you also gave your key takeaways to our listeners, with the herbs and vitamins. Of course, it's a generalization for general immunity as well, but these are good factors to incorporate.
And I think that also a nice aspect, and I hope listeners take away this, is that usually when you are diagnosed, the first questions that you are kind of asked is like, why did it happen to me? And then that's like the self aspect of it. But what I really appreciate about holistic healing is that it goes to the root. And so when you go to the root, it's not as you explained, where you can have different constitution, predispositions, etc. And so when you start researching those different elements, it helps accept why you've gone to this situation, and now it's like kind of how do we move forward. And so and it also allows to give you ways to move forward. So I'm very happy of our conversation today with Dr. Vignesh, where we are giving different elements for people to take with them if they are even for family members that are having experiencing this. It's a good tool to fall back on. So thank you for that.
Welcome.
And as we always round up our conversations, we go through our rapid fire questions. And so we have the first question is usually, what is the worst health advice that you've ever received?
All calories are the same.
Oh, that's
true.
Yeah, I've heard that too.
It's a good one. All right. And our second one is, if there was one habit we should all adopt, what would it be?
Surrendering to circadian rhythm.
I should take this advice. Go on.
Okay. No, I was like, if you were to explain slightly further, because I just would like to understand what he means exactly behind that.
So it's like going to bed by not later than 10:30, 11ish, and waking up by 6 o'clock.
So we should all do that.
Yeah, and then daytime, be active, and having a routine with your eating and a routine with your sleeping time, sticking to that.
Yeah, providing that safe environment so that your body, I just, this is the one thing that really kept in mind, like give as much components for your body to make it feel safe. And Tasha, the last question.
Yeah, and the last question would be, if you had to put a song or a soundtrack to your life right now, what would it be?
Well, after this COVID, with what is happening, don't worry, be happy.
Yeah, I think that should be everybody's theme song, actually. Yeah, that's a good one. Thank you for that. Well, thank you, Dr. Vignesh, for enlightening us and sharing your wisdom and being on our show today.
Thank you. It was a honor.